Hi, I'm Roger Margolis, Research Director at O'Reilly, and I'm here with the program chairs of the Strata Rx Conference here in Boston. We have Colin Hill of GNS and Julie Steele at O'Reilly, and it's been a great event so far, so that's been really fun. Now, the inaugural was last year.
Yeah.
A year has passed. What's changed since then, like both good and bad?
This is the center of the world of healthcare big data. Boston, Cambridge, absolutely.
Okay.
Happy to be here. We were in San Francisco last year, and that was also a wonderful event with a wonderful community, but there's clearly a strong healthcare focus here in Boston. So.
Yes.
Absolutely.
Yeah.
I think what else has really changed between last year and this year is that so many developments have happened in the broad world of healthcare that are pushing the topics that we describe and embrace at this conference really to the forefront. We've had Obamacare go from the beginning of implementation, surviving a couple of challenges, to it's now real. It's getting rolled out. Even the healthcare exchanges are getting rolled out in a few days. And that is a big new development. We've also had a growth of a lot of new data liquidity. New consortiums forming. Optum Labs is a new entity. We've seen acquisitions of some of the healthcare technology pioneers. And we've now even seen IPOs and a new kind of exuberance in both the private markets and the public markets. So there's a lot of momentum building behind this topic.
Yeah, just my observation has been it's become real.
Yes.
In the past, people have been talking about it, and particularly the data and health integration we've actually seen something coming out of it and not just speculation. I think that's great. But that brings up,
Sorry, I was just going to add on the technology side too, we're seeing a lot of things increasingly become real. So sensors and haptics and these contribute to telemedicine, to self-tracking, to all kinds of things, and are driving the creation of data that I think is becoming more broadly adopted.
the topic goes empirical instead of theoretical.
Yes.
So, speaking of topics, last year there were 10, you brought it down to 6. I'm just going to list them just so anyone listening knows. So we had precision medicine, which I think used to be called personalized medicine.
Yep.
Data liquidity, the thing I care about. Deal flow, this is all part of it's getting real and now money's flowing in. Value-based payment, patient engagement, platforms. How did you make the changes? What was going on in the world that?
I think this is a unique conference in that it tries to tie together many different parts of the healthcare ecosystem, from pharmaceutical companies and biotech companies to health plans and other payers, providers, the hospitals, the doctors, the health IT companies, the mobile health folks. And so it's really important to find those themes that cut across these different stakeholder groups. And that's what really makes the O'Reilly Conference Strata Rx, I think, so unique, is that it's not just pharma cancer drug discovery people talking to pharma cancer drug discovery people. You're seeing now conversations on, coming from both sides of the aisle, so to speak, where pharma companies that are producing new drugs and are having to commercialize these drugs are having the dialogues with the health insurance companies on the other side of those drugs in terms of pricing and even in terms of the concept of value-based pricing. We're seeing healthcare reform starting to seep into every aspect of the development of new drugs and the whole continuum of healthcare. And so these topics, we're really choosing them to really help to create these mashups of ideas, of people, of the folks from inside the big institutions, the medical industrial complex of Boston with the Silicon Valley disruptors and technorati. That's what this conference represents. And so these topics will continue to evolve. Even for 2014, we have a new set of themes that are really trying to continue to push the mashup of people and ideas and institutions together.
Can you say a little about the themes coming up?
Sure. I don't have them in front of me, but clearly a lot of these stay relevant. So value-based care and precision medicine, data liquidity, but a lot of them are so interconnected that the delineations are somewhat arbitrary. So trying to figure out how to divide them up and which to focus on is just a subtle shift. So we're going to be looking at things like culture change. We're going to be looking looking at things like new business models and business disruptions. But go to strataconf.com/RX2014 for a full listing, and our call for proposals that just went live today, so that's the place to get the latest.
Oh, great. One thing that I did notice here is ACO seemed conceptual last year, and now the language I'm hearing is all around the outcomes are more important than charging and stuff. Is that something that you see happening as well? And
yeah, absolutely, and I think it's broader than ACOs. I think the idea of paying for value versus volume is becoming the new norm, and of course, when you say it, it's like, duh,
Yeah.
of course this is the way it should be, but that's just not how our system was built, and so we've gotten exactly what we've designed and what we've created, which is now a system with runaway costs, with relatively poor quality, and so the whole ACO concept, which is really around the concept of value-based care, is becoming real, and even institutions that aren't becoming formal ACOs, they're still essentially changing their structure, and you're seeing payers working with providers in new ways. They don't have to put on an ACO hat to now start to get with the program, and ultimately, to quote the Tom Davenport's book, they're competing on analytics. As soon as you start to care about value versus volume, as soon as you really care about whether a certain intervention is going to make you better, Roger, or you better, Julie, then all of a sudden you need the data to drive that, and that's what's really driving why this conference exists. All of a sudden now we need a different kind of data-driven intelligence in order to make the system better and to make patients better.
And Colin mentioned that sort of East meets West, technorati meets traditional healthcare, but another sort of dichotomy we've been discussing between ourselves is this idea of the formal system and the informal system, and how those two are starting to collide in new ways. And so that's where you get some of that business disruption, and that's where we're starting to see some of those new models emerge. But that idea of bringing those types of systems together is really exciting to us. So.
Okay, and what do you think the data community can tell health, and what do you think the health community can tell the data community?
That's a good question.
Yeah,
that's a good question. No, that's I think the data community has at its core, in its DNA, is this facility with data, facility with databases and analytics, and also this belief, whether rational or not rational, that data can solve big problems. We've seen it before in e-commerce, we've seen it in quant finance. Data wins. So similar to Mark Andreessen saying that software will eat the world, data and data analytics, I believe, will eat the world. And there's a belief and a skill set and a tool set that the data scientists have that healthcare desperately needs. And I think going the other way, the healthcare experts and the healthcare institutions, they actually know what the problems really are, right? And so they are the ones that have to inform and help to guide the data scientists to the most relevant problems. It's not simply a matter of smart PhDs in computer science from Stanford and MIT coming into the healthcare field and pushing all the incompetent people out of the way to now fix all these problems. It's not that simple. There's a lot of smart people who have been working in these fields for a long time. What it really points to is a need to collaborate for those domain experts that have years and years of experience dealing with the messy, nasty data of healthcare, and who understand the business problems and some of the cultural and behavioral changes that need to happen to implement these things. They need to be tightly coupled with those really leading data scientists to make all this work. We've seen these types of problems be solved in other domains, such as online advertising. Let's solve them here in an area that really matters. What matters more than healthcare?
I agree with everything that Colin said, but I have a slightly different perspective. And to me, the thing that the data community can teach healthcare is about the value of openness and sharing, about the value of aggregation and publishing negative results. And I think that the biggest thing the data community can learn from healthcare is that at the root, at the end of the day, it's about people, so the human side of things, that data is a wonderful thing, statistics and analysis are wonderful things, but if you can't use them to solve human problems, then there's not a lot of point. So I think both communities are still learning and evolving on their own, but together there's a lot of potential.
I think you're right. Well,
That's a great point.
yeah, I think it is. I interviewed, I wish I remember his last name, he's the Chief Data Officer at Seattle Children's. He echoed just
Eugene Kokler.
Eugene Kokler. He was great, but he also said, I really need to bring the human side into the data. I think that's so important. So you guys have put on a fabulous conference. Looking forward to next year, and thanks for taking time to sit with us.
Thanks so much, Roger.
Thank you, Roger.